Welcome to Fiesta Friday, everybody. I'm Jason Salas, and glad to be here, and glad you are out there because we have a lot of information to pass along to you tonight. We are going to find out about Nissan Guam's new all-electric car, the Leaf. So you gearheads want to stay tuned for that. Top gearheads if you're into that kind of thing. Also, we will meet a pair of young gentlemen who have joined the cloth and want to serve the Lord, and they will be ordained, and they're inviting you to their historic ceremony. But first, this Sunday is the 14th Annual Guam Diabetes Conference at the Hilton Guam Resort and Spa. Now, joining me right now are some good friends of ours, GDA advisor, Mr. Mo Cotton, and one of the guest speakers, Dr. Joan Flanders. Half a day to you both.
Half a day.
Half a day to you.
All right, well, Mo, welcome back to Harmon, and
Thank
Dr.
you.
Flanders, we're very, very appreciative of your time.
Thanks so much for having me.
Okay, and obviously you come here as to deliver an informative and educational speech, but have you really let it sink in just how big of a problem diabetes is here in our island community? I mean, the numbers are staggering.
It is, and nobody really knows the prevalence, which is one of the interests that I have. The company that I work for is actually got a diabetes project that is looking at the incidence and prevalence in Guam because nobody really knows exactly how many people have it. And it's probably underreported even if we did guess. So.
Yeah, it's pretty alarming. Now, Mo, as someone who is a resident of the island, you know, you've been here for so many years, and as an advisor and everything, what's your input about, like just how big the problem and like how much we need information and outreach?
Yeah, I'm a member of one of the Rotary clubs called Sunrise, and we've been looking at how we can help because it is such an important issue and devastating. Every day you open up the paper, and there's people dying in their 40s and 50s, and it's scary, And so anyway, we decided we were going to spend a good deal of our time on diabetes education. And of course, every year we're going to have a different program, something that we can get involved with. And that I was present last year, and so we did a couple of events that. Again, educational, but mainly in my idea was to teach about nutrition. Education is extremely important, but in my feeling is that people have to learn that nutrition is really the key to avoiding it, and then once you get it, at least helping yourself with it.
And this specifically for this community, it's nutrition coupled with a lack of exercise seem to be the big contributing factors.
That's true, yes, definitely.
Okay. Is there a theme for this year's conference around which the various keynotes and hopefully some workout groups, breakout groups, will rally around?
Yep, I think the title is Compliance is the Key.
Compliance is the key, yes.
And so
I'll
it's
make
taking
sure
the
that's
advice
right.
that's given,
Okay, and what type of sessions will there be? And I guess for people like me, because my father is diabetic and it's affected my family, and we're trying to educate ourselves and understand the disease as well as its treatment. So is it also beneficial for us as well as the people directly affected by it?
Absolutely. The people who have first-degree relatives, so anybody, brother, sister, mom, father, anybody with a first-degree relative in their family with diabetes, that doubles your risk. So you're at risk. And your best bet at not developing diabetes is prevention. So absolutely. I'm a cardiologist by training, so my topic is going to be the keys to prevent disease, heart disease. And there are speakers on endocrine and diabetes specialists, and then I believe Dr. Titano will be talking about the medical implications.
An excellent speaker.
Yes, yes.
Okay, so who all is invited basically like that? Because of course, we have the direct patients and as Dr. Flanders just said, the first degree people like myself on behalf of my father, but is the community at large involved?
Yes, it's open to the public, and it's at the Hilton on Sunday, as you mentioned. There's 2 sessions, one in the morning. It starts at 7 in the morning, registration, and then there's one in the afternoon that starts at 1 o'clock. So if you can't make the morning one, you can make the afternoon one. And as far as guests, we have probably 10 different off-island medical people that are coming in for this conference. It's the Guam Diabetes Association. They're hosting it, and every year they do it. It gets bigger and bigger every year, and it's quite an important event.
Well, I'm sure, Mo, that your contributions are going to be greatly appreciated because, Dr. Flanders, what you're probably going to learn, and I'm sure you've been briefed on this already, is to maybe the baby boomer generation. that tends to be so affected by diabetes and contracting diabetes because of a lack of exercise again and poor diet. To tell that generation that they're unable to eat the types of foods that they want in the volume that they want is pretty much like it's imprisoning them.
It is.
And, you know, I mean, it's incarceration in so many different ways and everything. And to break that, you know, that mental cycle is an incredibly difficult thing.
It is, because none of us believe that we're going to get any kind of disease. And the scare tactics, that doesn't really work for people. It doesn't work for anybody. It's only real when it becomes personal. So you believe it because you've seen it with your father. But yeah, how do you motivate somebody who doesn't see it happening to them?
He
Wants a milkshake.
Exactly.
Yeah.
Oh, okay, well, that's going to be on Sunday this Sunday.
This Sunday, yeah, right around the corner.
Okay, excellent.
Yeah.
Okay, well, we will be there to cover it for you. And thank you so much for what you do. It's certainly a very necessary thing here. And again, we're very happy to have you as part of our island community.
Thank you for bringing us on.
All right.
Appreciate that.
All right, we'll see you there.
Okay.
All right, and stay tuned because we will be right back after this.